Hi, Patricia Ferris again, Blue Cliff College in Gulfport, Mississippi. This is video number 2 in a series about the 2008K Fresenius machine. We are talking specifically about this machine because this is the one that we have in the lab. We have 5 machines here in the lab at the school. These are the ones that our students learn to build. We learn to prime. We learn to run patients. We have figured out a way we can actually use a saline bag to mock run a patient on our machine so that we can get some charting practice in as well. We can also do rinse backs, and thanks to the phlebotomy arms that we have here as well, we practice cannulation and we draw labs. We learn how to draw labs. So we do a complete course here as far as patient care. It is a 12-month course. Not trying to sell the school on you, but I kind of went down that rabbit hole, so I wanted to explain a little bit about that. The part that we're doing right now, video number 1 was all about building the machine. So as of right now, the only thing that I have done to our 2008K is I have it built. So I have the lines on, I have my drip chambers set where they belong. I have my blood pump tubing correctly threaded to my blood pump, and I have my 2 patient connectors attached into my saline bucket, and of course my dialyzer. I have my my venous dialysate, my venous blood port connected to the top of my dialyzer, my arterial blood port connected to the bottom of my dialyzer, and I have my caps on my dialysate ports because I do not have dialysate in this machine at this given time. All right, so what we're going to do now for the second video, we're going to prime the machine, get it ready for testing. All right, so I'm going to set the camera down. One thing that I did not mention in the first video is notice that I have on full PPE. I have on gloves, a gown, and my face shield. I prefer to wear the face shield rather than the goggles and the mask because I wear glasses, so it is easier for me to wear the face shield. All right, so I have my bag of saline here. It is prepackaged, it comes sterile. So we tear open the bag. There is a perforated end on your saline. A lot of people have problems tearing this bag open. There is a little bit of a perforation in the end that they prepared for you to open. If you open that, your bag will come all the way open. All right, so it is usually on the end with your port where we're going to stick our saline. That helps a bunch. All right, so to hang our saline, you always want to make sure that you hang your saline bag with the numbers that are printed on the outside, facing the outside. This is very important, especially in dialysis, because if our patient were to get sick, were to get nauseated, or if they were to become hypovolemic or hypotensive, we would have to give them some saline. Our nurse would instruct us on how to give saline or to give how many saline. If you have your bag turned around where you can see the numbers on the bag, if your nurse tells you to give you 2, you know exactly how many you have. If you have this bag turned around the wrong way, then you cannot see your numbers. All right, so always make sure when you're hanging your saline bag, hang it with the printed side to facing you. All right, so I've got my saline hung, and now what I'm going to do is take my saline line, which is still connected to my arterial side. It still has the tab on it. I just tore that tab off, and I am going to connect my saline line to my saline bag. I'm going to go ahead and clamp this right here because there's some things that I want you to see about this saline. So I'm going to stop it from running down into my line. I actually want to show you some things about that. All right, so I'm going to take this cap off, and I don't know that I'm not going to have to recap this sharp at the end of my saline. So my cap that I just took off of there, I'm going to place here, right on top of my saline bag. This saline bag has a pre-port that is set for you to tear that part off. That goes into your garbage. You're going to take your saline, your sharp that comes at the end of your saline line, and you're going to spike the bag. This is what we call spiking. So you stick your sharp into the open port that you just took the tab off of and push. You have to push pretty good. You have to push pretty hard. Make sure that it is fully seated. It helps if you twist. You can see that I was twisting that. So it helps if you twist your sharp as it's going into that bag. Okay, so at this point, I have my saline bag spiked. Now, the reason that I clamped this line is because I wanted to show you how the priming process works. So right now I'm going to unclamp this saline, and I want you to follow the saline as it comes through. If you can see the saline coming through this line here, you see those bubbles coming through? That's my arterial line. It is a free-flowing line of saline, and it's going to come out into my saline bucket. And I'm going to let that run until I get no more air bubbles coming through there. Once I get a good steady stream of saline, I am going to take my red line and I'm going to clamp that closed. Notice that the saline has stopped running into my bucket. Okay, at this point we consider this arterial line primed because the saline is in our line. You can't see it because saline is clear, but we know that this line is full of saline because we saw it running out into that bucket. So now what we're going to do is we're going to fill up our drip chamber here. Okay, so there are two ways you can do this. I prefer to use the transducer protector line because on this line it's a double. If I were to use my medication line, I have to unclamp here and take the cap off. And if I use my transducer protector line, I only have to unclamp. So when I unclamp this, I want you to watch the saline level in my drip chamber. Unclamped, see that saline coming up? When it reaches the fill mark on your drip chamber, be sure you clamp that back and make sure you get your transducer protector line clamped before the fluid gets all the way up here and into. If you wet your transducer protector, you got to start all over. All right, at this point, this machine is ready for prime. If you notice, I am not in dialysis. I'm not in the dialysis program yet. I am still on the power section. I can still prime at this point. I cannot go any further than prime, but I can prime this machine without it being in dialysis mode. So we prime at 150. Our blood pump should be set at 150. I'm going to turn that on. You know it's on when the green light comes on and your numbers stop blinking. Then over here on my control panel, I'm going to push the button that says prime. Notice my marquee here on the face of my machine, on my touch screen. It says that it is priming and my blood pump is moving. All right, it is moving at 150 milliliters per minute. I want you to pay attention here. See the air bubbles? This is the saline as it comes through the blood compartment of my dialyzer. We have to reuse dialyzers here. We do not buy new dialyzers every time because dialyzers are very expensive. So we do reuse dialyzers. Your dialyzer, a brand new dialyzer coming out of the pack in clinic, will not have this kind of bubbles coming out of it. But because we dry and reuse our dialyzers, we do get a lot of bubbles. So if you can see the bubbles moving through here, and you can see them moving up and down, this is the venous line. And if the blood pump were not moving, then we would not be getting any saline through this line. So the centrifugal force of that blood pump moving. The peristaltic action of that blood pump pushes the saline through our line, and it comes up through our through our venous blood port. As it is going, it will eventually fill up the blood side of our dialyzer, and it's going to start to run out. You can see here the venous line is running out into our drip chamber. All right, this line I do not have to clamp because my machine, this 2008K, is automatically set to prime at 300, which is 300 milliliters. So this machine automatically knows that once it has run through 300 milliliters of fluid, it is going to shut off automatically, and it is going to presume that that line is full. And your machine at this point, if we had acid and bicarb hooked up to the machine, at this point we would be ready for test. All right, so while everything is still running, I'm going to check and make sure. Perfect. Just as I said that, you notice that my blood pump has stopped. The blood pump is not moving. My marquee on my touchscreen has gone back to select screen. And over here in my saline bucket, my saline has stopped running. I still have a drip because of gravity. Thank you, Isaac Newton, for introducing the law of gravity for us. So the law of gravity is still going to pull some of that saline out. For purposes of the video, I am going to go ahead and clamp my venous patient connector. All right, now what we have to do, the same process that we went through here where we filled up our arterial drip chamber with saline, we're going to do the same thing to our venous drip chamber. All right, I'm going to open the door so that you can see the saline coming through. When you are working on this in clinic, you will not do so, but strictly for educational purposes, I am going to open that door so that you can see the saline come in to this drip chamber. Now, hopefully it works perfectly, and it appears to be doing so. Notice the saline here. As it moves up into the drip chamber, it increases in volume. In our drip chamber, that is perfect. It's beginning to slow down a little bit, but that's okay. We have a fill line on this drip chamber as well. So as soon as our saline gets to our fill line on this drip chamber, we're also going to close this. We're going to reclamp our transducer protector line, making sure that that gets all the way up to our fill line. And there we go. So I'm going to clamp that. The saline will stop filling this chamber. Now at this point, I am going to reclose my door on my air foam detector. And our final step before we go into test, our final step is to arm our arm our venous line clamp. This is one of the most important patient monitors on this entire machine. This is your patient's last line of defense, because when the blood tubing comes out of this, it goes directly into your patient's venous access, to the venous needle and their access. It goes straight back into their blood veins. We all know that veins, of course, carry blood directly to the heart. So whatever is coming out of here is going, in a sense, directly back to your patient's heart. We want to make sure that there's no air bubbles in here. The air foam detector, that's its purpose, which we're not going to get too deep in this video, but I need to arm my clamp, my venous line clamp. I need to make sure that it is armed so that as it is testing, one of the tests that the machine goes through is the venous line clamp to make sure that it works. So make sure before you start your test that you arm this. So the way that we arm it, you pull the clamp down in the back. You're going to push your line in, and this is going to be hard to do because that clamp is tight, but you can push from the top and the bottom. Once you have it fully seated, once you have that fully seated in your venous line clamp here, see that line goes all the way through, then you close the door. All right, that is it. Our machine is fully primed. We prime at 150. Whenever you get acid and bicarbonate hooked up, we can go into dialysate mode, let the conductivity and the temperature come up on this machine, and it will be ready for testing. All right, that will be the third video in the series. This is priming, second video. Thanks.